Hi everybody, it's Dr. Magnifico from jarrettsvillevetandpobly.com. In this group of videos, I'm going to talk to you about life-threatening emergency conditions where you might end up at the ER and the cost of care might be more than you can manage. So I'm going to give you some tips on negotiating with your veterinary team and trying to get your pet out alive, because in most of these cases, if you don't get emergency care very quickly, your pet certainly has a high risk of passing away. So today's video is about GDV, which is gastric dilatation and volvulus. This is a condition where the stomach fills with air. If it fills with air, it's called dilatation. If it twists, it's called volvulus. If it fills with air, there's a chance and a good hope that you can burp it out, or it can pass through your intestines and you literally can pass it out as passing gas. If it twists, then that air gets stuck in that stomach, and that stomach will continue to expand. Your stomach is essentially a vat of bacteria that's degrading the food that was in your stomach. So it will continue to expand. The more it expands, the more uncomfortable these dogs will get, and the more acute this emergency becomes. In most cases, I see these dogs being larger, deeper chested dogs. So we see it in German Shepherds or any of the giant breed dogs, but it really can happen in anybody. The classic sign that I see in practice is these dogs will stand there with their head and neck extended. So they look like their head and neck is extended and they're trying to stretch out as much as they can, and they're trying to vomit or trying to burp, but nothing is coming out. The other thing that you will see is if you look along from the top of them, their abdomen starts to expand. So you should know what your dog looks like from all angles. And if you're looking from on top or from the side, that stomach is starting to expand, so the belly will start to expand. Dogs with a long coat or dogs that are overweight, it's going to be harder to recognize. But in those thin, skinny, short-coated dogs, it becomes pretty obvious. The other thing that you will see, and you will see as your veterinarian's doing the exam, is we will kind of ping the stomachs or ping that abdomen area, and it starts to sound like a basketball, really, because that stomach is just so tight and so distended with air. This is always a life-threatening condition. Even if it's not twisted, it can be a life-threatening condition. Your pet will be very, very uncomfortable, and if you don't relieve that pressure, they can die. The stomach will eventually explode and it will leak into the abdomen, and that will usually cause death. So we always want to treat it like an emergency. When you go to the ER, you need to tell them, I think that my dog has a GDV. They should see you immediately. You need to be demand to be seen immediately. Based on a physical exam, they should have a differential diagnosis. Every time you go into a vet's office and you're talking to them, you want to make sure you collect all the information, what time you went in, who you spoke to, and then collect all of that data. I've got a separate video on that, so see that. The other thing that you want to do is you should get a diagnosis very quickly. This should be something that is relatively easy to diagnose, and you should be able to ask your veterinarian, what's your top differential diagnosis? GDV should be very high on the list if we have a suspected stomach full of air. From there are diagnostics. Here's where you can start negotiating costs. It should be one x-ray. They should be able to diagnose this in one x-ray. Typically, we do a right lateral x-ray. If the cost of one x-ray is $100 and the cost of two x-rays is $200, ask them to do one. It should be diagnosed on one x-ray. So there's one place to negotiate. The rest of the things like blood work, it's nice to know, but if it's going to cost you $500 to do the blood and $1,000 or $2,000 to do the surgery, and you only have $2,000, you need the surgery more than you need the blood. You should be able to negotiate that. At minimum, you should be able to do a minimum database, which for those of us who went to vet school, it should be a very minimal database. Sometimes that's blood glucose, total protein, which is albumin and globulin, and then a basic kidney liver function. You may not have to spend that $300 or $400 on a full blood work because you have to get your dog to surgery. The cost of surgery is the next thing to talk about. Ideally, we want to get these guys under anesthesia, intubate them, see if we can pass a stomach tube, see if we can get the stomach to empty. Sometimes it hasn't twisted completely and we can remove the pressure just with the stomach tube. So that is not going into surgery. Anesthesia, yes, but not surgery. If it has twisted, then you need surgery. Someone needs to go into that abdomen and do the surgery. In an ER setting, this can be very, very, very expensive, $4,000 and up. If part of the stomach has died because it has been twisted for so long, then we're talking another $3,000 to $4,000 or more. You have to remove that dead part of the stomach. If you cannot afford any of that, if you cannot afford anything with anesthesia, the next thing that I would recommend that you do is you have that veterinarian put a large bore needle into the abdomen and relieve some of that pressure. That might buy you some time. It is not ideal. Your pet still needs to have an emergency surgery and get that stomach untwisted, but it might buy you 6 to 12 hours. Remove as much of that air as you can, and then you need to find somebody who will take care of you at a reasonable cost. Once the stomach goes down and gets smaller, it is easier to untwist it. In some cases, you may not need to remove any tissue, which is the hope. Then we want to tack the stomach. That's another thing to talk about. We don't want this to happen again. There are lots of wives' tales out there about how you might be able to avoid it. I don't know how many of them are actually true, but you've got to get your pet some help. If you have any questions about this, you can find me at pabli.com or Jarrettsville Vet. Please collect all of your information, collect all of the itemized invoice that they give you. Pay attention to my other videos because they'll kind of go over that with you, and then get out alive. Good luck, everybody. Please let me know if you found a place that you think is great or a place that you felt didn't help you. We are going to start collecting information so we can better direct people to the resources that they need. Take care and good luck.